sort of what specialist team is needed for this type of post-stroke care? And do the symptoms of these post-stroke patients, does that change who is involved in sort of post-stroke care?
Yeah, yeah. So one of the things we talk about sometimes you basically motor deficits, so they can't move. So those are all negative symptoms. But one of the things we talked about earlier is the tone, muscular tone. If tone is actually a positive sign, tone goes up, and another name called a spasticity. It's actually intrusion to the motor recovery. And it poses a lot of challenges. And then your arm becomes stiff, then you can't move at all. There are a lot of treatment, there's medications, and there's few devices being tested. And believe it or not, a botulinum toxin actually can also use to inject some toxin to the muscle, and then you make some muscle relatively weak, and then with therapy, and then you can break the spasticity and then make the passive movement a little bit better, but not always can make it an active movement better. And neurologists, stroke neurology, treat those patients. And there's another big specialty called physical medicine rehabilitation, physical medicine rehabilitation physicians. They also be part of the team. Then physical therapy and occupational therapy, speech pathologists, and such, clinical psychologists, all be part of the team. And because, as I said earlier, and patient can have only motor symptom, or they can have a motor symptom, sensory, language, vision, all together. So they have a lot of needs.
We're always talking about innovative ideas and how can we change the space, and what are we doing to sort of change the space. So I know that we've expanded our capabilities on sort of treating and rehabbing stroke, but are there specific innovations or approaches that you'd like to see maybe garner more attention, or even have more devoted research towards it going forward? Is there anything specific that you've kind of keyed in on over the last couple of years?
Yeah, absolutely. I think first we need to classify patient a little bit better. We need to learn things from cancer and treatment. We need to study those patients a little bit better with imaging, genetics, and electrophysiology tool to understand the stroke recovery process a little bit better. And then you come up with new technologies, and such as brain stimulation. There are so many tools. Other things we really think about is really brain computer interface for those very severe patients, or use stem cell. But we completely simplify and estimate the complex process of using stem cell. That's why the last 10 years all the animal study some sort of disconnected with the human study, and we never really can push the stem cell into the next step. Means we really don't understand it very well, the recovery process, or how the stem cells really can be regenerate the neuron, how flow form network. So I think with all those things, I think it's still very challenging disease to rehab. But number one, we need to understand it better. Second is we need new tools and new technology, new device, new medicines.